It felt like a hammer pounding on the back of my head, like nothing I've ever experienced before. I knew that there was something very, very wrong. My first instinct was to call my husband because I knew there was a chance that I would not survive, and I wanted to make sure that I had a chance to tell him how much I love him and our 3 children. In that less than 1 minute, my entire right side was paralyzed. I could not feel it, and I was losing my ability to speak. I looked down and there was a picture of my youngest daughter, Leela, a baby picture, and I remember thinking, I need to stay awake. I was very, very fortunate. The medics arrived in 4 minutes.
So it was very important that she was brought to Sharp Grossmont because that's our comprehensive stroke center and it's our neuroscience center. Dr. Chalasani arrived with a ruptured brain aneurysm. The aneurysm was not bleeding currently, but it had bled while she was in the car. And there was a very fragile clot on the top of the aneurysm. And if that clot gave way, she would have more bleeding into her brain and probably would die from that. So she was in a very tenuous position when she arrived. We needed to do emergency surgery to repair the aneurysm and make sure it couldn't bleed any further.
He told my husband at that time that I had a 50% chance of survival.
The coiling procedure is one method that we have to fix intracranial aneurysms that have ruptured or that haven't ruptured. And what we do during the coiling procedure is we go in usually through the leg, and from there we're able to navigate catheters all the way into the brain. And from there we can inject little pieces of metal which coil up into the aneurysm and clot the aneurysm off from the inside.
So I went into the procedure, and when I emerged, he spoke to my husband again after the procedure and let him know, yes, we were able to coil the aneurysm. We were able to stop the bleeding.
Dr. Chalasani turned around very quickly. So when she arrived at the hospital, she wasn't in such great shape. She wasn't responding very well. She wasn't moving part of her body. But within a day or so after the coiling procedure and after the body had some time to take away some of the blood naturally, she became wide awake and was able to interact with the physicians and the staff, and she really looked quite good.
I am amazed at the care and compassion and dedication of the staff and the nurses and the physicians.
We've been treating these complex neurovascular patients at Sharp Grossmont for many years, but the new Neuroscience Center has allowed us to expand our treatments even further and treat more complex patients in an even safer and better manner. And we're very proud of the work we've done with the new Neuroscience Center.
Putting together a comprehensive neuroscience center like this is giving patients who previously had fatal conditions the best possible outcome, returning them to their families, returning them to work, and returning them to the life that they were living before they became sick.
Philanthropy has played a huge role in what we're doing here, from building the Burr Heart and Vascular Center to the new Neurosciences Hospital. It's played an enormous role. We're able to purchase equipment, we're able to invest in staff, and ultimately we're able to change patients' lives for the better. To all the donors, thank you so much for your generosity and support. You've allowed us to get to where we are today.
Now that I am home with my family, I am grateful for every minute that I have with them. I realize that one thing that could have been different or changed, I may not be here to be there for them.